Hello, everybody. I'm Peg Lorraine. We are sitting today with Kristen Hoag. Kristen is the chair of the Belchertown Overcoming Adversity Together committee here in town, more familiarly known as BOAT. So we're going to introduce BOAT to you a little bit today, talk about some of the things they do, and we have the pleasure today of hosting one of the partner organizations with whom BOAT works, and we'll get a little information on MiraVista Behavioral Health, and then in the future we hope to return and meet with a number of of BOAT's partner organizations so that you get to know more about the Belchertown Overcoming Adversity Together committee. So Chris,
yes,
can you say offhand how long the committee BOAT has been in existence?
Yeah, so BOAT was founded in June of 2016.
And so we're 9 years in.
Yep, 9 years in, and the original name of BOAT was Belchertown Opioid Addiction Task Force.
Right.
And when it was created, it was obviously created to combat the opioid epidemic that is still going on. And so that was created, and then in 2019, the committee decided that we need to touch upon like prevention,
many other
and treatment
aspects,
and recovery,
right? So
and harm reduction.
Broadened the scope.
Yeah.
Of the task force, which then became a committee. Was that the time?
Yes. Yep. So the task force changed to Belchertown Overcoming Addiction Together, and that was in 2019. And when they changed it because they wanted to include all those other parts of BOAT, just besides opioids, but to include prevention, treatment, recovery, and mental health and wellness and harm reduction. So what the committee did is they partnered with Quabog Hill Substance Use Alliance and WARE, and started to talk to them about a grant that they received, which is called Drug Free Communities Grant, through the Office of National Drug Control Policy and Health and Human Services Department. And so Gail Gramarosa was the director of prevention out of WARE at the time, and was kind enough to come over and work with our public school district and our SOAR, Speaking Out About Addiction and Recovery program.
SOAR, yeah.
Right?
SOARR.
Yep, SOAAR.
AAR?
Yep, Speaking Out About Addiction and Recovery. Yeah,
SOAAR.
So Gail partnered with the two of them, and they decided to go after the Drug Free Communities Grant for our town, which was one of the reasons they changed the name to expand it to prevention, because Drug Free Communities is primarily a youth prevention program. And so back in 2019, they changed it to that. They got the Drug Free Communities Grant in 2020. So for 1 year.
Right in COVID, right?
1 year.
Right.
There was nothing that was being done for a year until I got hired in 2021, May of 2021. And so when I was hired, we, a year and a half later, after I was hired, in December of 2022, we brought in a master trainer from Community Anti-Drug Coalition of America, CACA. CACA is the training academy for drug-free communities programs. And two members from the drug-free communities group coalition must attend a 3-week academy through CACA.
Is that annually, Chris?
You only have to do it one time when you have the grant. So 2 people have to attend that fall under that. And so Dr. Fortin and I both attended the academy for 3 weeks right in the beginning. We met Dorothy Cheney, who is a master trainer, and we decided to bring her in to our coalition and do a day-long leadership training. And we had put 12 sector representatives in place to get the grant. And now the 12 sector representatives represent parts of the community like law enforcement, government, a health sector representative, a business representative, a school representative, a youth serving representative, a youth representative, a fraternal religious sector representative, and a civic volunteer representative. And so these 12 sector representatives that signed off to be sector reps didn't really understand their role on BOAT when we first got involved. So the training that we put together, we brought Dorothy Cheney in, the master trainer from CATCA, and we did a whole long day training and looked at data. We looked at the PNAS surveys from like 2019, 2021, and we looked at the data and we came up with logic models which describe what a problem is in the community. So a problem might be alcohol. Okay, well, what about alcohol is the problem? And okay, perceptions might be the problem. That might be one thing. Youth perceive alcohol as being low risk, right? And so, or maybe ease of access is a problem, and this is something that we did work on with tobacco, ease of access. Youth said that they could easily get tobacco products from our local businesses. And so being able to look at the data and look at what the issues are, we can look at the local conditions and apply our initiatives that we have created from our data to the local conditions that are out there. So for example, with that data that we took about ease of access, we worked for a year long with the local businesses that hold tobacco licenses, and we provided them with a toolkit in the beginning with like the proper signage that needs to go into their facility. For example, Massachusetts has laws that state you have to have this specific signage in your business facility around tobacco products. Like, one sign might be you must be 21 years old to buy, tobacco products. Or
I'm sorry for interrupting, Chris, but it seems to me that if you are a merchant and you're selling those products, that you would know. You wouldn't get your business license and the like, absent the presence of those signs or that information. So did these people were they not aware of these requirements? Was this new information?
Yeah, so no, it's not new information. However, as far as like compliance checks weren't being done because of COVID. And so, when we have, maybe new businesses or new business owners or they changed hands, they don't necessarily have that signage still in the stores.
And the information doesn't always transfer.
Right. And so when I did environmental scans as soon as I got on board in 2021, and I documented that 100% of our businesses were out of compliance with Massachusetts state law in posting signage. So what we did is we met with them, and I worked with the Board of Health, the Director of Public Health in ordering signs. We put together a packet with all the required signage.
Oh, I see.
And I put together a packet of a 20-minute video for new employees to look at about asking for proper identification. And the Massachusetts Public Health webpage has that video. And so I attached it into the document. And we also, so we gave them a bunch, tips and information like facts about you selling to youth. We also gave them like a little jar, like a change thing that they could put on their counter that has the date right on it too. We gave them some products.
Date of birth, right?
Yeah, the date of birth.
If you are born
correct
after this date, then you can't legally purchase.
Well, that's
that
something new. That's the nicotine-free generation that just came into play. If you're born after a certain date, you can't purchase. But when I was doing this, it was still 21 plus. And so, we gave them all the correct signage and we got them up to date. 3 months after I did that, I went around again, 100% were in compliance. And good. Then I took it further and I did a purchase survey check where I had a youth that looked, or a 21-year-old that looked under 21, and I had them go in to ask for cigarettes, purchase a pack of cigarettes, and see if they were doing what they were supposed to do, which is IDing people that
checking
look. Yep. The rule is like under 30, but really it is under. People say under 40. If a person looks under 30 years old, you should card them. That is the rule of thumb.
And if a vendor in town hires a new employee, is there required training for that employee?
There's no required training for tobacco licenses. There's no. It's up to the employee to do that. And it's the same thing with alcohol. I'm a tip server training, which is training for intervention procedures for alcohol, serving alcohol, and that is required in some states for any businesses that hold alcohol licenses. In Belchertown, it is not a requirement for businesses to take that class.
Interesting. I know that I sat on the select board for a little while and I've observed the meetings for years. I do remember that in particular Mr. Aponte would always ask a new license, someone who's coming in to apply for a new license, if the employees were TIPS trained. So that was only because it was an interest of his, and it isn't a required. We're not required to ask that
It's
of
not
a new license holder.
And we can do that locally. We can require it through the select board if they choose to do that, going forward. They did require it for the new restaurant going into the golf course. They did require it for that new, those new people. So I did train, I think, 16 employees from that organization for that. So the tobacco compliant, like the tobacco training and the alcohol, like those aren't requirements in our town. So
let's go back a step. The name of your committee is Belchertown Overcoming Adversity Together, and I have a recollection that changed from addiction to adversity because your committee is not just interested in tobacco use or opioids. You follow mental illness issues, you follow public health issues, you follow alcohol, tobacco, drugs, and various other things which put not just youth, because I know that you don't limit your interest to the kids,
right?
But the exposure to risk, of course, is greater if the people you're working with are young. So we're not just tobacco, you're not just alcohol, you're not just drugs, you're not even just suicide prevention. All of these issues come up at every one of your meetings. I have your agenda from earlier today in my hand, and among you have you have upcoming and recent events, what I guess the select board would call discussion action items, but at the bottom you have updates, and you get updates from the Opioid Settlement Fund Committee. You talk about your abatement conference, which I think is coming up for you. Public health updates, prevention and drug-free communities. DART. Explain what DART is, please. What is that acronym?
Oh my gosh.
I know. I'm sorry. Yeah. But I don't know what it is you talked about.
I know what it is. It's like diversion. I don't remember risk something.
Okay, stop pounding on the table because the microphone's picking up. She's never. Okay, but you also talk about recovery, harm reduction, and then you have updates from other partners. Now, you had your Umbrella of Wellness Fair, which is an annual event now, this past Saturday, and you had, when we spoke to you prior to the fair, 75 people, groups, organizations, potential partners for boat, who were coming to table at this event and disperse with usually flyers and sometimes swag and information about their organizations, which is great for both, but was also, I believe you said, an opportunity for them to get to know one another. Can you talk about that tapestry effect?
Yeah, sure. So we ended up having, I think 60 showed up.
And the weather was awful. So
which was really great. We still had a ton of people there.
Isn't that great?
Yes.
But they still came, is what you're saying. Okay.
So one of the purpose for this whole fair to begin with is just to empower people in our community and to educate people in our community to get the help they need or the resources that they need that they might not know exist. And so all these organizations that are coming here, people look at it and they're like, we have 60 organizations that we can go to. Like, there's a heck of a lot more than that. And
75, and that's not everybody.
That's not everybody.
Who signed up,
right? And so we want to introduce all these resources into the community because people don't know they exist, and it takes a village, right? It takes a village. So another purpose of this whole thing is to have these organizations connect with each other, like you said, to be intertwined, because we are all working together, and we, if I can't provide a certain service or a resource to somebody, hey, maybe I know another organization that might be able to help you.
Exactly.
And so that's why we want to be I want to be able to have everybody connected so that we can utilize each other.
And I'm assuming now it seems to me, because I think we've been to all of your Umbrella of Wellness fairs, it grows with every passing year. So community members with any concern really about the well-being of themselves, their families, or their kids could attend an umbrella of wellness fair and be, I think, surprised at the breadth of information that was available. They also have the opportunity to get in touch with Chris if you can't do anything else and you're not sure where to go or what to do. You are a resource. Our police department is a resource. I noticed today, well, I've noticed it in the past, you partner with them. They're very active in this. And of course we have a school resource officer. The police department has a huge vested interest in the youth of our town, and I think all of the residents. So any questions around need, addiction, mental health, depression, fear of suicide, any of those questions can be directed to the police department or to Boat, really through Chris. If you're not sure that there's help for you, I'm pretty sure that there is, and this is a good place to start. We were hoping to have a guest today, and she's been a little bit delayed on the road, so we're think she's coming in now, and we're going to introduce Kimberly Lee from the MiraVista Behavioral Health Center. So Kimberly's coming in now. Kimberly, all right, we're moving on now. I said to you earlier that we were going to meet one of the partner organizations with whom Chris and the Boat Committee work. So we're introducing Kim Lee today. Kim is with the MiraVista Behavioral Health Center. Am I correct?
Correct.
All right. And she is going to tell us a little bit about MiraVista and the services that they offer, especially because, as we were just saying, if you don't know where to go, start with Chris, and she can direct you into the services that you need. So Kim, can you talk about MiraVista a little bit?
Sure, absolutely. So MiraVista Behavioral Health Center is what once was Providence Behavioral Health Hospital, which was part of the Trinity system many years ago. And Trinity decided that it was no longer going to provide the services that were in the location in Holyoke. And so upon hearing that, the state of Massachusetts reached out to a group of individuals. We have a sister hospital in Devens, Massachusetts, which is Terra Vista. So the state of Massachusetts reached out to Terra Vista and said, we really would hate to lose these inpatient psychiatric beds and all the outpatient substance use treatment that's happening here for residents in Western Massachusetts. Would you at all consider taking ownership of this property? And they unequivocally and almost immediately said yes. So one of the individuals who purchased the building actually grew up in Long Meadow, and his father was a physician, and so he grew up knowing the value of good quality health care and behavioral health care. So it really wasn't a hard answer for them to give in terms of taking ownership of that.
I'm sorry, and did you say when was that?
So that was back in 2021 is when MiraVista officially opened.
I see.
As MiraVista in Holyoke, Mass.
All right. So, but aside from the behavioral health, which is an umbrella, what exactly you have inpatient beds to offer, and how many of those are there? And I understand your clientele specifically. This is youth oriented. Am I correct?
No.
No.
So
okay.
Thank you for asking. So MiraVista.
Good thing I did, since
yes,
I apparently didn't know.
Absolutely no. So MiraVista Behavioral Health Center offers inpatient psychiatric treatment for both adolescents as well as adults, and then we have a whole host of outpatient substance use programming that happens as well. So we have adolescent beds for young people between the ages of 13 to 17, 18 if they are still attending high school, and then we have 4 units or 72 beds which are designed to treat adults.
I see.
So anybody 18 and older who's not in high school, all the way up through 70. We have individuals with us who are in their 30s, their 40s, 2060s and early 70s.
All right, so one of the things I don't think that I've said so far is that the month of May is National Mental Health Awareness Month. As full disclosure, Lou and I both in both of our families have experience with family members who suffer from mental illness. And so we're somewhat conversant with the services and the things that are needed by families like this. But you were going to explain to us why this month, why is it important to take this period of time and highlight this need?
I really do believe that having a conversation about mental health is significant year-round, but having an opportunity, specifically the month of May, which has been designated, as you had said, as Mental Health Awareness Month, gives us all a heightened opportunity to talk even more specifically about the need for mental health awareness and the importance for individuals to start talking about how they are feeling emotionally. We were at a flag raising yesterday with the mayor in East Hampton, actually, and she said something that was so eloquent and really spot on, which was, she said, you know, I go and see my therapist every Tuesday, and I feel just as comfortable telling you all that as I do that I have a dentist appointment on Thursday.
Right. There should not be a difference. There is sometimes, but there shouldn't be.
But there shouldn't be, exactly. And the only way that we'll begin to silence the stigma is to begin to just talk about mental health more openly, to be transparent and to be, conversational about it. Nobody ever has any qualms with telling you how their belly feels, or
Right.
How their back is, or geez, their joints or their knee, or they're going in for shoulder surgery. But when it comes to mental health, we really don't. We're not that conversant. We're not that open about
I
it.
suppose because it's in part because it's frightening, and also because most families, in my opinion, have some relative, ancestor somewhere in their family or in their past. Most families have been exposed to mental illness, but it's a hard thing to explain to your friends or your neighbors or other people like that. It's a tough thing. So let's see how you want to put that, formulate that as a message to families or individuals who aren't sure what to do, aren't even sure what they're seeing sometimes. They see something as disturbing about themselves or a family member, and they don't know what to do. They don't know who to ask. They don't know where to turn. Can you talk about that, please?
Sure. So, I think first and foremost, individuals should be aware of the resources such as BOAT that are available to them in the community. There is a 988 helpline. There is the Massachusetts helpline. There are tons of resources available through the Substance Abuse and Mental Health Services Association, which is SAMHSA.
Mm-hmm.
There are resources on MiraVista's website, and certainly primary care, pediatricians' offices are all very well versed in what resources are available for individuals who are seeking mental health treatment.
Well, that's an interesting thing. You are confident that primary care providers, pediatricians, and the like, they actually understand? Do they simply have access to the information, or do they have a full grasp of what it's like for a family who might come to them for help with a baffling issue that they hopefully would recognize as potentially a behavioral health issue? I
would hope so. I would think that physicians in their capacity and the positions that they hold are understanding of what's behavioral health, what's behavior, what's true mental health. They may themselves not be willing, in a position to formally diagnose somebody, but they will have access to the resources where that diagnosis can happen. Something important to note with MiraVista is that we are now accepting direct admissions, which means individuals no longer have to visit the emergency department
I see.
in order to come inpatient. That is a major step forward it's an advancement in terms of individuals being able to access an inpatient level of care without the cost, without the trauma, without the time that is often experienced when people do visit the emergency department because of a mental health crisis.
The delays, the misunderstandings, the things that can get in the way of coming directly for help.
Emergency departments are really not equipped for mental health. They will assess the crisis that you're experiencing and then, rightly so, move you along. But emergency departments are really for when individuals have had a car accident or when there's a broken bone. So being able to move individuals who have a mental health challenge or are in crisis away from the emergency department means less barrier or more barrier-free access, if you will, to them getting the services that they need more immediately.
I remember that as though it were yesterday. We had a family member in crisis, and I remember distinctly the emergency room physician saying to us, our focus is on the physical health of the patients. We don't focus on their mental health, and you need to get help elsewhere, which that's clear and maybe commendable because they understand their role, but was a frightening thing to hear as a family. Get help elsewhere. Where and how and where do you begin? And it's 4:00 in the morning. So that's the direct admission or whatever you called it is probably really critical.
And just to also mention that there are throughout the state of Massachusetts, and I know Vote is very familiar with these, but community behavioral health. So CBHCs, Community Behavioral Health Clinics. These are walk-in, 24-hour access clinics that are available throughout the state of Massachusetts. So they, too, are an alternative to an emergency department experience.
If the family knows that such a thing exists and knows how to go there and how to find it, which is in large part, I think, the role of Vote to make that information public, which is very good. So let's talk about the one thing that you would like viewers to remember after today's conversation. What's the most important thing that you have to bring as information to Belchertown for today?
413-264-3042.
I'm writing it down.
413-264-3042. That is my telephone number at MiraVista. And if at any time anybody has a question, whether it be about MiraVista or other mental health related supports and services in Massachusetts, please call.
It's very interesting from our perspective now, 50 years after we first entered into this world of mental illness, to hear about all of the resources that are available to people. I know that mental health is not your sole focus. I know that addiction is not your sole focus. Depression's not, suicide is not, drug-free communities, but it's nice to know that very broad spectrum of help is out there for anyone who wants, even if you just want to make that phone call and say, here's what we're experiencing, should we be concerned?
Right.
Which is not a bad thing for people to have access to, we think.
Now, I have a question for you about MiraVista. So you had mentioned to me a while ago, that some services have changed?
So we did. We at one point had offered inpatient detox, and 2 years ago we closed that program. However, for individuals, because we know substance use and mental health really at times do go hand in hand. You know, that dual diagnosis can be very prominent. Many people will turn to misusing substances because they are trying to quiet or suppress a mental health challenge that has gone undiagnosed. if individuals have a primary diagnosis of mental health, and we can help them receive that, we can help connect them with clinicians in the community who can help them with that assessment. So with that primary diagnosis of mental health, we're able to treat their substance use inpatient, which would mean a safe detox. And then because MiraVista has so many outpatient substance use programs, for example, we have an opioid treatment program, we have an intensive outpatient program, we have one-on-one counseling in multiple languages. So individuals can be treated for their mental health with MiraVista, but they can also be treated for their substance use
For
as
substance abuse,
Mhm.
substance use. All right, I'm grateful to have met you. I think this is wonderful,
Thank you.
I'm particularly grateful because of our family experience. It would have been so nice to know these things 50, 40, 30, even 20 years ago,
Yes.
that we had a place to go and a place to turn. And I will admit, you've spoken frequently of NAMI, or the National Alliance
Mhm.
for Mentally Ill,
Mhm.
with which our family had experience. So that is yet another.
Indeed.
Um,
And they're in our
resource.
building.
Are they?
They are the Western
Is that the
Mass.
Western Mass?
The Western Mass
Yes,
chapter
yeah.
is actually co-located with MiraVista in Holyoke.
And
It
that,
is.
in our case, was a sort of a family help, a place to go for family help. I know that family members went to find out what to do in coping with like a
Yes.
family member who needed help and maybe wasn't getting it, or wasn't getting the right help or timely help. I know that all of these things are complicated, and I know that every program is limited to some degree by their resources and their physical space, but at least it sounds like if not one thing, maybe another. When something doesn't work, maybe there's another place to go. So we are grateful to you both, and we are expecting this to become a series. So we'll be back with Kristen, and you are very welcome back at any
Thank you
time, Kim.
so much.
If
Thank you.
anything changes or anything's new, you can come back and tell us about it. So we're going to keep you as fully informed as possible about the resources that are available to families, friends, acquaintances, neighbors, anybody who has a question. Real quick, let's get an email from each of you,
Sure.
Kim, that people can reach out to if you don't object. I know Chris doesn't, but you're new to us. So let's get an email for Kim.
It is KLEE at MiraVista BHC. So that's KLEE at MIRA V like Victor, ISTA, B for behavioral, H for health, C for care, .care.
Oh, that's a new one.
Not
Care.
.com.
C-A-R or C-A-R-E? Is it C-A-R?
CARE .care.
C-A-R-E.
sounds
All right,
good.
that's a new suffix to me, so that is good to know. So now you have that, and now, Kristen, I know we know yours, but let's have it
Yep,
again.
it's KHOAG at BelchertownPS.org.
All right, so questions for either Kim or Kristen, and we are going to be back with you with various other partnering organizations, and we will do our best to keep you fully informed. And if you have questions, direct them to Kristen or to Kim, or you can direct them to Lorraine at AOL.com, because we will pass them on.